What singers have battled Lyme disease? This is part of a common sense Lyme disease series where I discuss this case I've seen in my practice and questions that have been raised by my patients. So Lyme disease has affected many of artists. They've been sharing their stories, but it also has affected, of course, patients in my practice, their children, and I'm happy to summarize some of the stories that have been shared in the media. Avril Lavigne was diagnosed in 2014, and she was bedridden for months. She eventually improved after a long struggle. She shared her story, and she also shared part of her story in a release of Head Above Waters. Daryl Hall had chronic Lyme symptoms, has been discussing the issue for years. There was brain fog, fatigue, difficulties, and he frequently speaks about misdiagnoses and some of the long term effects. Justin Bieber was diagnosed in 2020, fatigue, skin issues, depression, and he's shared his story. More recently, he's discussed a facial paralysis called Ramsay Hunt syndrome that has affected his career and his singing voice, but he frequently shares his stories publicly. Chris Christopherson was misdiagnosed with Alzheimer's. Lyme disease was the real cause. His memory improved after treatment, and he was able to return to writing and performing, not at the level before, but his wife shared his 10-year journey of being mistaken for an Alzheimer's case. Shawana Twain was diagnosed in the early 2000s. Vocal cord damage from Lyme disease. There was surgery required, extensive physical therapy, but she was able to return to music with a different voice. She shares her story. So takeaway is that Lyme disease can cause serious hidden symptoms. It's often misdiagnosed. These singers showed that recovery is possible. Now, I'm not their doctor, so I wouldn't be surprised if there's some symptoms left, let alone the memories of how it affected their career, memories of how it affected them as an individual. So I'm happy that these artists have shared their journeys. I certainly have patients who share their journeys. I'm blessed to be able to work with patients who are struggling and patients who have success stories. I thought I'd tell you those success stories are very gratifying, make my career very satisfying. And I also struggle and work with patients who aren't getting better. So thank you for joining my Common Sense Lyme Disease series, and have a good day.